Well, good morning, and want to just extend a warm welcome to all of my friends in the Southeastern HIMSS affiliates. Really wish I could have been there today. I have two keynotes in Boston, so couldn't both be in Tennessee and Boston at the same time. So I was asked to speak a bit about the stimulus bill, about ARRA, about the various committees, the plans. Where is all this going to go? What are you going to see over the next couple of months, and what should you do? What should you advise your customers, and what should you advise your organizations? Well, as folks know, ARRA has made available some $44 billion, some $19 billion net to be paid from Medicare and Medicaid, as well as $2 billion in discretionary funds that the Office of the National Coordinator will allocate. As you've probably seen, there are two RFPs out, one for regional healthcare IT extension centers and another for health information exchange. Now, just to talk a bit about those two RFPs. So for healthcare information exchange, ONC is really looking to the states. So there'll be 50 of these awards given, and the idea is state governments or their designated entities would run the healthcare information exchange activities for the state. So I'll give you an example for Massachusetts. In Massachusetts, we have NEHIN, the New England Healthcare Exchange Network, which I run, a nonprofit, which has done benefits eligibility referral authorization claims and e-prescribing and clinical summary exchange transactions for Eastern Massachusetts and some Western Massachusetts affiliates. But also, we do have some small regional exchanges. That is, we have some towns. We have Brockton, Newburyport, and North Adams that have small exchanges. We have the Fallon Clinic, which has its Safe Health Exchange. So how do we put all this together? Well, in our case, the state has agreed to serve as a thin convening entity. And that is, it's not going to rebuild infrastructure. It's not going to eliminate any of the existent regional health information exchanges or NEHIN. It's going to put us all together with a single governance model, and we'll have some committees that will ensure that common standards are used. And so imagine that if a city or a group of hospitals decides to come together into an exchange, that it'll plug into the NEHIN exchange as a statewide entity. Now, of course, we're going to need privacy policy and security standards. And again, the state, as a convener for a health information exchange, will ensure we're all adhering to the same privacy policies and security standards. So think of it as leveraging the work of the past, but providing a governance layer. So we'll be putting in the Massachusetts HIE application at the state level. Similarly, the state has chosen to submit the application as the Regional Healthcare IT Extension Center. And yes, we have the Mass eHealth Collaborative, and we have some local efforts. We'll put all those together, all that experience together, with the state serving as the convening entity, the entity that is sort of the thin front door by which federal funds are received and dispersed to multiple contractors. And so I would certainly encourage you, as you think about applying for these funds, healthcare information exchange, focus on the state, come together collaboratively. Although it is true you could have multiple state applications, in my view is, since ONC is looking for coordination, is looking for overall collaboration, coming up with one single point of entry per state is going to give your application the best chance. And on regional healthcare information extension centers, the idea that there could be regions, there could be multiple state collaboratives, but try to your best to put together collaborations of multiple stakeholders leveraging the work you guys have already done, and try to make it as broad as possible. I mean, ONC is not going to have an easy time administering lots of these. So, hey, fewer, more collaborative, coming together. This is going to be a really great application for you. So there's $1.2 billion that's going to be made available, $600 million for HIEs and $600 million for regional healthcare IT extension centers. Now, once you've got that, once you've got the IT, once you've got the healthcare information exchange, of course, we need to pay attention to meaningful use and certification. And if we're going to get those stimulus funds, now, obviously, we don't want to focus exclusively on these stimulus funds. We want to focus on getting doctors to use healthcare IT. We want to ensure patient care improves, quality improves, efficiency improves. So how do we achieve this interesting balance of getting doctors to use these applications wisely? And hey, as a side effect, the stimulus funds will flow to those doctors. Well, remember there are two governance entities, the Healthcare IT Policy Committee and the HIT Standards Committee. Let me talk about those and how those will contribute to getting to meaningful use and giving us all guidance as to what we should do. So the Healthcare IT Policy Committee has three subcommittees, one on meaningful use, one on healthcare information exchange, and another on certification and adoption. So the Meaningful Use Subcommittee has produced a very nice matrix now of FY11 required criteria for meaningful use. It's not just about buying software, it's about really using it to improve quality and coordinate care, empower the patient, offer educational materials and access to the record to the patient. And you'll find that if you just simply search on HIT Policy Committee on the web, you can go to any of the minutes of any of the meetings. You'll see all the handouts. You'll see the meaningful use criteria matrix in its latest updated form. Now you can assume that there's going to be additional work on meaningful use done on 2013 and 2015 timeframes, but the 2011 meaningful use criteria are pretty much set. So given those criteria are set, well, what else is going on in the policy committee? So what you're finding on certification and adoption is how is it that we will ensure that there's software with functionality that will support meaningful use? So certification and adoption work group has looked at the landscape and said, here's the way we should do this. ONC should come up with certification criteria, and of course it will leverage work that's been done in the past. And then NIST should be charged with assigning multiple entities to do conformance testing. So CCHIT is a natural to do some of this conformance testing. Now you can guess that these certification rules will be much more privacy and security and interoperability focused than in the past, where they were largely functional criteria. So example of certification might be, we want to ensure e-prescribing is going to happen and make sure that every product is capable of using NCPDP script 8.x or 10.x to achieve interoperability with entities like SureScripts that facilitate e-prescribing. So hence, ONC comes up with that guidance, and then NIST, through its various other third-party entities, does conformance testing. So I think what you'll see is a notice of public rulemaking coming out in December about certification. You'll also see some interim final rule in December about the standards that will be incorporated into products that are certified. And then I think you'll probably see in the spring of 2010 the full certification program fully laid out. Now the HIE work group is defining what are those health information exchanges that we're going to need to do in 2011, 13, and 15. So in 2011, they're going to be the ability to view lab data electronically. Not order labs electronically, not yet. Standards aren't fully baked, but view. So you need to be able to receive lab tests from Quest, LabCorp, hospitals, or other entities. You're going to need to be able to submit quality measures, about 30 of them, as defined by the National Quality Forum, its HITEP group, and the Standards Committee's work group on quality. And those will need to be submitted to quality measurement entities such as CMS. You'll also need to be able to submit immunization data to public health if such entities have the capacity to receive it. You'll need to do e-prescribing, and that means formulary checking and the benefits eligibility check and routing, drug-drug interaction, drug allergy checks, and the ability, once this is routed, to ensure that the medication has got from end to end in a standards-based and non-repudiatable way. And so this is where the SureScripts network or other standards-based networks ensure that. Now, there has not been work specifically on the e-prescribing of controlled substances, and DEA is doing some pilots on that. So for now, it's paper-based for controlled substances and electronic with that benefits eligibility, formulary, drug-drug interaction and history, and routing end-to-end securely. So also, you will have HIE requirements for benefits eligibility, referral authorization, and claims. Specifically, those are going to be the administrative HIPAA transactions. So that's all the HIE activity. Now on the Standards Committee side, we have 3 work groups. And those work groups are on the clinical operations, clinical quality, and security and privacy. And so clinical operations has specified those exact standards that are necessary for data exchange between organizations. Between organizations, not inside an organization. We've specified contents, vocabulary, and secure transmission standards. Clinical quality has come up, as I mentioned, with these 30 specific quality metrics that will be required for meaningful use. And privacy and security has come up with both the best practices, such as regulatory HIPAA best practices, inside an organization, as well as those privacy and security standards for exchange of data between organizations. So you'll see very specifically what are the standards required for 2011, certification criteria, and implementation guidance to get them done. So that's what's going on the HIT Policy and Standards Committee side. So you can use that guidance to ensure that your Regional Healthcare IT Extension Center, your HIE, are following these federal guidelines. All this is happening very fast. But you'll see over the upcoming weeks all these matrices, all these materials released by all the various committees in their final form, as I mentioned, December, with the publication of the interim final rule and comment on regulation. So I have great confidence that in 2010 we'll all have the guidance that we need to get doctors and hospitals using these technologies in a meaningful way and ultimately impacting the quality of care we deliver. Now I blog about this every day, so you'll find geekdoctor.blogspot.com has the goings-on of the Standards Committee, has the publication of these various matrices, so keep watching that. And I'm always available to you by email. And so at jhalamka@hms.harvard.edu, I'm always happy to answer your questions. So I hope you have a great conference, and I hope that your groups take a great leadership role in all the grants and all the stimulus activities to come. 2010 will be a great year. Thanks.